Hi, my name is Roman Casciano. On behalf of my co-authors, I'd like to present an overview of our study, a quantitative assessment of patient barriers to insulin, a study designed to assess diabetes treatment preferences with a focus on insulin therapy. Diabetes remains a progressive disease with generally poor long-term outcomes. Fortunately, there are a wide variety of new and established treatment options available to control glucose levels and perhaps delay the long-term consequences of the disease. Despite this, it has been well documented that there is a gap between what can be achieved with the current available treatment options and what is actually observed in diabetic populations. This gap has been attributed to a variety of factors, not the least of which has been a proposed hesitancy or a barrier to initiate more aggressive treatments such as insulin when additional glucose control is necessary. Our research set out to better understand attitudes towards insulin therapy in Africa and the Middle East, Asia, Eastern Europe, and Latin America, and to better quantify the extent of the so-called barriers toward insulin, as well as the factors which influence those barriers. To do so, we employed a survey based upon a conjoint analysis methodology to over 14,000 patients with type 1 or type 2 diabetes in 18 countries. We found that route of administration was the attribute with the highest estimated importance across the entire sample when compared with other more relevant clinical attributes such as effectiveness and side effects. Importantly, in a stratified analysis, this finding was only evident in type 2 diabetic patients who were insulin naive. In populations that had experience with insulin, such as type 1 diabetics or those type 2 diabetics on insulin, route of administration was found to be the least important attribute, lending credence to the concept that there is an initial barrier to usage which is lessened following first-hand experience. We also observed that patients receiving diabetes education were more likely to shift their concerns towards these important clinical factors and away from mode of administration. These findings underscore the value of providing education to eliminate psychological barriers regarding diabetes treatment options, since the attitudes towards the ideal treatment may change as perceptions are replaced with real experiences. Thank you.